Welcome to the Dr. Mama Says podcast, where you will hear a variety of timeless tips on parenting and healthcare. Thank you so much for joining today, and now it's time to get on with the show.
Hey everyone, I'm Dr. Burton, the host and creator of the Dr. Mama Says podcast. As always, I really want to thank you for once again tuning in. Today's episode will bring an end to my series on sinus infections, and I'm going to be discussing several different types of surgery that may ultimately be needed to finally resolve those sinus infections. I have already discussed the basics about the sinus cavities. I've talked about diagnosing and treating sinus infections, as well as some of the potentially life-threatening complications that can happen if we aren't able to get those sinus infections under control. If we can't get them controlled, surgery may be the answer. And there are actually several different types of surgical procedures that could be performed to improve sinus infections. Although they're not all directly performed on the sinuses, some of these sinus surgery types can make a huge difference in ultimately controlling these sinus infections. So first of all, when do we consider sinus surgery? I generally talk about sinus infections in terms of two problems, both of which cause a blockage of the drainage sites, but one of them is a functional blockage that comes and goes, and the other is a physical blockage which remains narrow no matter what you do. After using several different types of medical treatments like saline washes, various allergy treatments, or antibiotics if they're needed, I sometimes find that I cannot completely get rid of sinus infections. So in these situations, I've done everything I can to reverse functional swelling, so now I become concerned that there is a physical narrowing that I'm not able to improve. So this is when I perform a nasal endoscopy. Putting a telescope in a child's nose is never one of your first options, but if I'm concerned there's a blockage, I may do the endoscopy, or I order a type of an Xray to look and see what other kind of blockage can be back there. By the time I'm starting to perform procedures or X-rays, I'm already thinking surgery may be warranted. So what actually should you expect if sinus surgery is going to be recommended? This is a really important question. Regardless of the type of surgery performed in any part of the head and neck area, patients are always hopeful that they will no longer have any problems. I cannot emphasize to you enough how important it is to talk to your surgeon to fully understand what are the goals of surgery. Many surgeries do not stop the problem from coming back. On the blog post that goes with this podcast, I wrote that sentence in capital letters as if I was shouting. Maybe I shouldn't have done that, but I hope that it will draw attention to an important take-home message, that surgery may not completely resolve whatever the underlying problem is. In terms of chronic sinus infections, all surgery is ever designed to do is to improve the ability of the sinus cavities to drain. That's it. If you have allergies or other medical problems, you may still need medical treatments to keep the swelling from coming back and blocking up that new space that surgery just created. So let that sink in for a minute. You will probably still need to do some type of nasal care to keep your newly opened nose and sinuses clear. Please listen to what your surgeon says and recommends for you. I cannot tell you how many people come back to me, tell me how great they felt after they had surgery, but over time they've started not feeling so good. Of course, I ask the obvious question, what kind of nasal care are you doing? 9 times out of 10, you know what, I'm going to move that up 99 times out of 100. People will say, I didn't need to do anything until just recently. Well, that's not really a surprise now, is it? Your body is going to do what your body's going to do. We all have different medical problems, so the goal of treatment is to improve how you feel, come up with a plan for you to be able to keep yourself healthy. This is really important to know. I say surgery is kind of like rebooting your computer. It's a do-over. You now know things you didn't know before surgery. So after surgery, you get the opportunity to plan ahead since you know what's coming. You can do things differently that had you known, you could have prevented something. Do the things that you can do to try to keep your health as good as it can be. I discuss this exact situation when I have patients with ear infections and ear tubes. Just because a surgeon creates a hole that allows improved drainage, this doesn't mean you're not going to still have that underlying problem. However, now, perhaps medical treatments that didn't used to work may be more successful. That's another little take-home message for you. Just because a medication or treatment option did not work before surgery, it may work now. Remember, surgery just rebooted your system, so just like you start over with your symptoms, you start over with whatever treatments may be recommended for you and give them a shot to see if they can work now. As a surgeon, I would love for you to do whatever it is you take, whether it's saline washes every day, whether it's, controlling dust, whether it's avoiding anything that you know causes a stuffy nose. I would love you to do that so that you can come back and lavish awesome praise that my surgery did all of these things for you. Remember, surgery gave you a hole, but whatever it is that you're doing, you are keeping my hole open, and I just get to take the credit. But I also like to avoid patients coming back to me, giving me a little side eye and saying things like, I thought surgery was supposed to keep this from coming back. No. I was helping you to keep this from coming back. All right, so now on to the surgery itself. If surgery needs to be done, what kind of surgery is going to be recommended? Essentially, I break these down into these 5 basic categories. I only do kids, so these are really all that I do. There are more options in adults. However, this is what we're going to focus on because it covers most adults and kids. Number 1, the adenoidectomy. The adenoid is a lymph node that's found way in the back of the nose. So just like any other lymph node, it swells whenever it tries to fight off infection. Usually, once the infection or inflammation goes away, the adenoid returns back to normal, unless it doesn't. Chronic nose problems may lead to chronic swelling of the adenoid, which may lead to blocking the nose, which then leads to a sinus infection. In these cases, removing the adenoid may improve a stuffy nose and then reduce sinus inflammation and infections. This is a very, very common treatment for young kids who are being treated repeatedly for sinus infections. By late teenage years, the adenoid usually shrinks down and isn't so much of a problem. Usually all that's left is the leftover chronic stuffy nose and sinus swelling. But when I was in the Army, there were some young adult soldiers who had breathing and sinus issues, and sometimes they were still found to have some quite large adenoids. The next category is called the septoplasty. In one of my other posts, I spent a lot of time detailing the anatomy and function of the nose. There, I also highlighted the nasal septum. It's a tissue made of cartilage and bone that divides the nasal cavity into 2 equal passageways. However, if the nose becomes crooked, the sinus drainage sites can become blocked. Surgery to straighten out a crooked nose can be done alone or combined with traditional sinus surgery. Once again, the importance of surgery is just to create more room so the nose and sinuses drain more effectively. Lots of things can cause a crooked septum, which is very different from having a crooked nose as you look at it from the outside. Just remember, crooked on the inside changes how we breathe and how our sinuses drain. Crooked on the outside changes how we look. They can happen together or separately. Category 3 is called the turbinate reduction or turbinate resection. What's a turbinate? Those are those structures inside the nose that swell up when you get a cold or an allergy. I think most of us have had days where one side of our nose is blocked and then the other one. Those things that swell and block our nose, it's called a turbinate. Surgery to reduce enlarged turbinates may be done in several different ways. However, it's unusual for me to perform this surgery all by itself in kids. Many times, this surgery in kids is also done at the same time as when I take out the adenoid or actually perform surgery on the sinuses. Now, in adults, because they can tolerate procedures in the office, it can sometimes be done alone, which can buy time and hopefully try to avoid the need for more extensive sinus surgery. Category 4 is actually the nasal polyp. Nasal polyps grow because of a chronic inflammation of the nose and the sinus. The nose and sinuses are lined by tissue called mucosa. It's a special tissue that lines the entire respiratory tract and makes important mucus to help us fight infection. If this tissue becomes chronically inflamed, it just swells up. Over time, when the swelling becomes worse and more chronic, the swelling matures into polyp structures. When the polyps are small, they may not cause any symptoms, and they might be able to be treated with something like a nasal steroid spray. However, larger polyps often need surgery, which can also be combined with sinus surgery. When the polyps are seen in the nose, many times that's just the tip of the iceberg, that they actually start in the sinus and have been growing over time until now they've spilled out into the nasal cavity. There are some people with recurrent polyps, and sometimes they just get a polyp removal just to kind of open up the nose enough to continue with chronic treatments. And of course, the last category is actual sinus surgery. True sinus surgery performed on the sinus cavities to open up their blocked drainage sites. You want to remove the mucus and the swollen tissue and allow air to reach into the sinuses. I like to think about sinus surgery in 3 categories. I think you're noticing a pattern that I like to categorize things. Really helps you to keep your thoughts in order. So the first category are what I call temporary procedures. The first one is sinus irrigation. Basically, we place a needle through the side of the nose and use salt water and flush out the mucus out of the sinus. I used to do this in the office on adult patients, or in the operating room in kids when I'm already removing the adenoid. They had a lot of sinus infections, so did a quick rinse out of the sinus to see if we could keep the sinus infections from coming back. But this really didn't change anything. It rinsed it out, and then the process of swelling the sinus continued, and the infections recurred as if nothing had changed. The next temporary procedure was something called a nasal antral window. Antral has to do with the maxillary sinus, the big sinus in your cheek. That big center cavity is called an antrum. So nasal antral window is a hole from the nose poking directly into that maxillary sinus. It was all the rage in the 80s and the 90s because the maxillary sinus natural drainage site is actually much higher in the nose. If you pinch your nose at the bridge, you'll feel some hard bone. Right up about that area is where the natural maxillary sinus drainage site is located. So, mucus that's lower into the maxillary sinus had to travel all the way uphill to drain out. This procedure was made to make a permanent hole lower down in the bottom of the maxillary sinus so that the mucus could just quickly drain from the bottom of the sinus into the nose, but patients weren't staying better. They were happy for a while and then their symptoms came back. Why? Because the body is created to do what the body is going to do. Our making a new hole didn't change that. The whole structure and function of the sinus was designed to take mucus up that hill to drain out of that blocked sinus pathway. So studies were done putting some blue dye into the sinus, and when they would watch, the little hair cells in the sinuses would move that mucus up, and as it got close to our new hole, it would just skip all around it and carry all this blue mucus up to that blocked sinus drainage site. That's when we learned the body has to use its natural drainage site. All right, so the second category of sinus surgery is what I call the old school open techniques, meaning everything wasn't done with the telescopes like we do now. One of the big procedures was called the Caldwell-Luck. This was the workhorse of sinus surgery. I did this procedure several times a week. You would lift up the lip, make an incision in the gum line, and then you can look directly at the bone on the front of the sinus in your cheeks. You make a hole in that bone, and you reached in and you cleaned out all the polyps, the mucus, and on X-rays, that sinus looked beautiful. And we often did this procedure with that other hole I just talked about, made a big old hole so that everything could drain out. But despite doing this extensive surgery, patients still were sick. In fact, I still have some artwork in my home today, created specifically for me for a patient who I operated on when I was a chief resident. He had severe sinus infections and nasal polyps, and because of these open surgeries are so extensive and bloody, we often had patients, they had to donate their own blood. They would donate several bags of blood and have it on standby, and then we would schedule surgery. Knowing that it was a bloody, long, lengthy 4 to 5 hour operation, we could give them back their own blood so they didn't have to get a standard blood transfusion. And with all these procedures, all of the sinuses done on one side, that's all we could do in one day. We would let them heal up. Weeks later, they would donate blood again and come back and we would do the other side. Yes, that was real life. And it was the standard of care back then. Medical advancements are so amazing, aren't they? Another old school open sinus surgery we used to do was called the frontal sinus obliteration. Remember the frontal sinus is on the forehead. If infection gets trapped in them, option 1, as I talked about in my complication podcast, is that the infection can poke through the forehead and drip out through the skin. But option number 2, the infection can go backwards on the inside and then the infection can spread into the brain. So if we could not control the frontal sinus infections, we would make an incision in the scalp and then get access to the bone on the front of the forehead, remove the bone, clean out the sinus, and then fill that sinus in with fat from your belly. The goal was, since we couldn't keep the natural hole open, we would just close that sinus up and pretend it didn't happen. It was a very difficult operation because if any of that sinus tissue was still in there, infections would come back. These old school procedures, thank goodness, are not a standard because the real sinus surgery, when anybody talks about it now, is what's called functional endoscopic sinus surgery, or FESS, FESS. Sometimes you just call it endoscopic sinus surgery or sinus surgery because nobody really does that open stuff anymore. This just got rid of all the incisions, all the big long procedures, and there was a specific goal of finding the natural sinus drainage sites and opening them up. We use fancy little telescopes. We have instruments to remove tissue and bone to make the drainage sites bigger. As an aside, I want to just say I feel like a museum piece as I'm thinking about this because I'm honored to have known many surgeons who have created instruments that are used every day in ENT surgery that really weren't used when I was training. The instruments did not exist, but my colleagues saw a need and created them. They revolutionized so many things that surgeons just take for granted right now. So I'm just going to give a shout out to Dr. David Parsons. He was an Air Force ENT doctor who I knew in San Antonio. He was inventing telescopes that helped us to look into the airway, and he started making those in his garage because the instruments that we had weren't good enough. And another shout out to Dr. Rod Lusk. He was in St. Louis, and when this endoscopic sinus surgery was first developing, the instruments were so big and bulky they weren't helpful in kids. So he made instruments that allowed us to do the sinus surgery on younger kids so that they didn't have to suffer so long. Now a new generation of surgical pioneers are doing their thing. Balloon sinuplasty is sort of the latest creation. It was created by an engineer who was also a physician, but he personally suffered from sinus infections, but they weren't felt to be severe enough to undergo this endoscopic sinus surgery. So he created a technique that allowed a balloon to go into the natural drainage sites and to expand to open up the sinus drainage sites without moving bone and tissue. In adults, it can be done in the office or in the operating room. It has been done in kids. It's not as popular, but who knows what the future may be. This might be the standard of care for kids in the future. And the last type of sinus surgery is really pretty much the same as the functional sinus surgery I just described. However, if the infection is severe or somebody's had previous surgery and scarring, the sinus surgery may need to be done under Xray guidance. The same procedure is done, except before surgery, the CAT scan is done while the patient is wearing a headset, so that during surgery, when that headset is placed on the patient, the X-ray machine can be coupled with our telescopes so that while surgery is being done, the X-ray machine shows in real time exactly where you are. It reduces the risk for the surgery when the anatomy is not normal and can be difficult to tell exactly where you are. Obviously, this procedure costs more, so it's not needed for everybody, but it's great to have for the people who qualify. Bottom line, chronic nasal inflammation, regardless of cause, should be aggressively treated to reduce the risk of developing chronic sinus infections. When medical management fails, surgery may be needed. And then, aggressive medical management will still probably be needed to prevent sinus infections from worsening again. This seems like a good place to end, so for now I gotta go. If you know someone who could benefit from hearing any of my tips, I would be honored if you could share my podcast with them. But thank you for joining me, and I hope you come back and check out another episode soon.
I truly want to thank you for spending your time listening to Dr. Mama Says, because without you, there would be no podcast. If you enjoyed what you heard, please go to iTunes and consider leaving a 5-star rating. This will help gain the support needed to continue bringing new and exciting content. To review information presented in this episode, a summary of the show can be found on www.drmamasays.com. And don't forget to subscribe. Hope you come back and listen again soon.